This is a fantastic question, and somebody above asked the difference between hypertrophic and keloid scars. So we'll start there. So hypertrophic and keloid scars are kind of relatives of each other, is a nice way to think about it. So the top one here is hypertrophic. So you can see it's thick and pink, and it looks like a rope, but it's within the bounds of the incision where it came from. Now this one on the bottom, this is a gallbladder incision. You can see that is not the bounds of the incision. It has spilled out over the side. So this right here is a keloid. This right here is a hypertrophic scar. So similar, but there's a difference. I find that hypertrophic scars are a lot easier to treat, and they're a lot more common than keloids. So as for your question right here, how do hypertrophic scars and keloids look on darker skinned individuals? Is it the same as I described or different? So the simple answer is it usually always starts out the same. So as you can see from those photos, and one of the patients was darker skin, it is pink and thick and angry looking and inflamed. With time though, with darker skin patients, they have more of a tendency to pigment from that inflammation. So you are correct, the hypertrophic scars do turn dark in many patients with darker skin. But interestingly enough, that doesn't always happen. So I see hypertrophic scars in darker skin patients all the time that remain pink and never pigment. So if scars pigment, we can add things to the regimen that I mentioned in this prior video. So instead of just doing things to turn off the inflammation, we also want to add things to your treatment that are going to turn off the pigment making and allow your pigment to fade.